The Philippine Cancer Society Board of Trustees and its Executive Action Team pursues the Philippine Cancer Vision, a country well prepared to meet the cancer challenge and a citizenry made fully aware of the threats of the disease. PCS fully supports the Quezon City Council on their quest for an ordinance on cervix cancer control to further implement the Quezon City Integrated Cancer Control Ordinance. PCS with QC dedicate this message to the Filipino woman, aiming for their good health to the best of their well-being always. In Filipino culture, mothers are the center of the home and are given the title of ilaw ng tahanan. They are seen as the first teachers guiding their children to become good people and future leaders of the country. Ang kalusugan ng ating mga kababaihan ay parating alagaan, lalo na sa laban ng cervix cancer. Ang cancer sa kwelyo ng matres o cervical cancer ay pangalawang pinakamadalas na cancer sa mga babae dito sa ating bansa. 8 babae ang namamatay araw-araw dahil sa cervical cancer. Isang pamilyang Pilipino ang mawawalan ng ina bawat 3 oras. So tara na, sama-sama tayo. Laban na tayo, laban sa cervix cancer. Alamin natin kung ano ito para malabanan natin ito. Bago magkaroon ng sakit na ito, ano-ano ang mga gagawin? Ano-ano ang mga iiwasan? Practice good hygiene, maintain healthy weight, take fruit vegetable diet, don't smoke, practice safe sex, use condoms to reduce the risk of contracting HPV, do pap smears, pap tests. Pap tests can detect changes in the cells of the cervix before they become cancerous. Start getting pap tests at age 21 or as soon as sexually active and continue every 3 years until age 65. It is recommended that girls and boys receive the HPV vaccine at age 11 or 12, but it can be given at age 9 up to age 26. HPV vaccination is highly effective against HPV infection. 90% of HPV strains that causes cervical cancer against 90% of HPV strains that cause anal cancer and genital warts. If not HPV vaccinated, about 99% of cervical cancers are caused by high-risk type HPV human papilloma virus infections, and most HPV infections are self-cleared. That is, 90% actually regresses. Going back from high grades, cervical intraneoplasia, to low grade to normal. However, 5 to 10% of cases have persistent high-risk HPV infections and can develop cervical cancer. And this takes 16 to 30 years to transition to from HPV infection to cervix cancer, enough time to prevent its occurrence via detection of its precursor, cervical intraneoplasia, and early cancer. For those at risk of cervical cancer, how would we help them? How would we do cervical cancer screening? Pap smear, wherein the cervix is swabbed and the swab specimen can be inspected under microscope if there are abnormal cells. 2. Visual inspection of the cervix washed with acetic acid or vinegar, and the cervix would appear normal, HPV infected, or with cancer. And third, this would be HPV DNA testing, which when positive, one is prone to have human papillomavirus infection and at risk of cervical cancer. Guidelines are available to set up cervical cancer screening, particularly for low to middle income countries, categorized by resources of the locality, maximal, enhanced, limited, basic, defining age group, age when to start, screen modality, and frequency. And according to resources, management options are defined including type of healthcare facility and service provider after screen positive. Of great importance too are education, awareness campaign, an effective referral system, and a positive doctor-patient relationship with outcomes of treatment captured using cancer screen and treatment digitalized registries. The Philippine Cancer Society is always here supporting the Cervical Cancer Control Ordinance of Quezon City and at the service of the Quezon City community fighting to control cancer. And yes po, together we can. Salamat po.